The following is an encore presentation of a pre-recorded program. Chats and evaluations were only available during the live presentation. To join one of CJE Senior Life's many live presentations, please visit cje.net/events, call 773-508-1000, or follow us on your favorite social media platform.
My name is Sharon Dornberg-Lee, and today I'm joined by my colleague, Lisa Andrews, and we're both clinical supervisors with CJE Counseling Services. And it's our pleasure to welcome you today to this Insights on Aging program, which is our monthly series. And today's program is checking in on mental health. And we're going to talk about common mental health concerns, such as depression, anxiety, caregiver stress. And everyone's going to get a chance to take 3 completely confidential quizzes during the course of our program today. So just a few things I wanted to mention before we get started. If there are any professionals attending today, I want to let you know right at the beginning that we don't offer professional CEUs for this program. These monthly community education programs are part of an effort by CJE Counseling Services to highlight important aging and mental health issues for the individuals and families we serve. Please also be aware that Insights on Aging programs are recorded and will later be available on our website, cje.net. So if you provided an email address when you registered for the program, you will be sent a follow-up email. You should receive that tomorrow with the link to this recording on our webpage, as well as the slides from today's program. But even though you'll get the link right away for this recording, it will take a while for that actually to be posted to our website. It could take 2 or 3 weeks. So you'll see our other programs there from the past right away, but this program will take a while to appear at that link. And since this program is being recorded so that we can share it publicly, there are additional privacy features in place today, and your live participation will be completely anonymous. And unfortunately, that means you won't see the other participants, but when you use the Q&A feature, you will be able to chat with us, but your name won't be shared when you use that feature. So we really encourage you, excuse me, to use the Q&A feature at the bottom of your screen, and feel free to ask us questions. But just to avoid confusion, we disabled the chat feature, so it's not coming in 2 different places. So use that Q&A feature. I also want to let folks know that we've enabled auto transcribing and closed captioning for today's program. To use those features, you're going to need to turn them on manually on your device. So you can do this by selecting the CC live transcript icon that should be at the bottom of your screen. And then you can either select subtitles or full transcript views, and you should be able to adjust the font size as well to meet your needs. We will be monitoring the Q&A throughout the program, so if there's an issue that's really important to address right away, then we will get to that. Otherwise, we'll probably take most of the questions at the end of today's program. Finally, before we start, I want to mention that CJE Counseling Services does offer a full range of older adult behavioral health services. This includes individual, group, and family psychotherapy, support groups, and family and caregiver support. And all of these services are available right now through telehealth. And that can either be online with video, like we have today, but 2-way, or it can be on the telephone if that better meets your needs. And if somebody can't participate in telehealth for whatever reason, we also offer in-person, face-to-face sessions in our offices on a case-by-case basis as needed. And we're still following COVID protocols like masking and distancing, et cetera, to reduce unnecessary exposure for our clients and staff. So with all of that onto our program, we chose May to do this because May 20th is National Older Adult Mental Health Awareness Day, and all of May is Mental Health Month. So this month we are focusing on a mental health checkup. So with that, we're going to move on to our program, and we're going to get right into the content. We're going to skip ahead. Lisa's hosting our slides today, so if you'd forward, Lisa. And I'm going to do part of the program, and Lisa will do a bit later. So we're going to do, to begin with, the 3 quizzes. One's on depression, one's on anxiety, and one's on caregiver stress. And then we're going to give some tips for self-help, for self-care, just for good mental health and ways to reduce stress even during this challenging time of a pandemic. And then we're going to give some practical resources and answer some questions and talk about next steps if you need more help than just self-help. So first, it's important to note that mental health symptoms, feeling depressed, feeling anxious, we can all feel this way from time to time. But when it is persistent, when it's lasting, for example, 2 weeks or more, feeling depressed and feeling anxious are not just a normal part of aging. Sometimes people think, well, this is just, my lot in life. I have to have all these symptoms and just bear them. And that's really not the case. These symptoms are symptoms of an illness when they persist, just like any other illness. But the good news is about depression and anxiety is that they're treatable illnesses. So it really behooves all of us to, make a point to check in on our mental health. And that's true for everybody of every age. And to say, am I struggling with some symptoms of depression or anxiety or caregiver stress, and then get the help that we need to feel better. Next slide, please. Thank you. So we're going to begin with mental health screenings now, and we're going to start with the depression screening. So I'm going to go through this slowly. Don't get confused. It's going to be easy. But the first screening is for depression. It's called the PHQ-9. And I'm going to ask you some questions, and everybody's going to need a piece of paper and a pencil or a pen. So if you need to run and grab that, please do. You just need somewhere. Some people might want to do that on their phones if that's easier. You're just going to need a piece of paper and a pen or somewhere to jot down these numbers that are going to correspond with your answers to the questions. And then at the end of each quiz, you're going to just add up the numbers, and that's going to give you a score. So for this first one, each question is going to be, and the questions begin on the next slide. Over the last 2 weeks, how often have you been bothered by the following problems? And for each question, you're going to write down a number. If the answer is not at all, you're going to write down 0 on your paper. If the answer is several days, you're going to write down a 1 on your paper. If the answer for you is more than half the days, you'll jot down a 2. And if it's nearly every day, you'll write a 3. So all you need to write down are those numbers in one column that correspond to each question. So let's get started. And the first question is, how often over the last 2 weeks have you been bothered by having little interest or pleasure in doing things? And then write down a 0 on your paper if it's not at all, a 1 for several days, a 2 for more than half the days, or a 3 for nearly every day. Second question, feeling down, depressed, or hopeless. How often have you had that problem over the last 2 weeks? 0, 1, a 2, or a 3. And you can see the answers on the top of the slide there as a reminder. Number 3, having trouble falling asleep, or the opposite, sleeping too much, or staying asleep. So in other words, have you been having trouble sleeping of any kind over the last 2 weeks? How often? 0, 1, 2, or 3. Feeling tired or having little energy. Write down the number that corresponds with your answer. Not at all, several days, more than half the days, or nearly every day. Having a poor appetite or overeating. 0, 1, 2, or 3. Feeling bad about yourself or that you are a failure or have let yourself or your family down. Write down your answer for that question, the number. And there's just a few more on this quiz. Number 7, having trouble concentrating on things, such as reading the paper, watching TV, etc. How often have you been bothered by that problem? Number 8, moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you've been moving around a lot more than usual. If you've had either of those problems, write down the frequency, 0, 1, 2, or 3. And finally, a really difficult question. Have you had any thoughts over the last couple of weeks that you would be better off dead or even of hurting yourself? And the number that corresponds with that question. So you should now have a column with 9 numbers in it, 1 number for each question. And I'm just going to ask you to take a minute and total those numbers, get the sum of those numbers. And that will give you a score for this depression test called the PHQ-9. If your score was 1 to 4, that means that there's really minimal or no depression at all. And really, you don't need to do anything else to take care of your mental health, but you might want to try some of these self-help tips that we're going to share today. If your score was 5 to 9, that does indicate mild depression. And that's still something that's important enough, it's interfering enough that you should consider counseling or discussing it with your doctor and or using these self-help tips. If your score gets up in the 10 or higher level, that means you have 10 to 14 as moderate depression, and you really should consider at that point counseling and discussing it with your doctor. It's really indicated if your score is in that 10 to 14 range, because that means you're having enough symptoms that it's worth getting some assistance with that problem. If your score was 15 to 19, or even severe depression, 20 to 27, then I'm going to really encourage you not to even wait, but to really make use of the crisis resources we're going to give you today, to give us a call, to contact your doctor. These are really in the range where it needs immediate attention, and you owe it to yourself, and we hope that you'll avail yourself of some support and help. Next slide, thank you. So with that, we're going to move on to the next assessment today, which is the anxiety screening. So this is very similar to the last one. You're going to start a new column, and I'm going to ask you a few questions, and the response categories are exactly the same, where you're going to indicate with a 0, 1, 2, or 3 how often you've been bothered by any of the following problems that I'm going to ask you about on the next slide. The first one is feeling nervous, anxious, or on edge. Write down a 0 for not at all over the last 2 weeks, a 1 for several days, a 2 for more than half the days, and a 3 for nearly every day. Second question, not being able to stop or control worrying. Write down the appropriate number. Number 3, worrying too much about different things. Number 4, having trouble relaxing. Please write down the appropriate number. Number 5, being so restless that it's hard to sit still. Number 6, becoming easily annoyed or irritable. And finally, number 7, being afraid as if something awful might happen. Please write down number 0, 1, 2, or 3, whichever best describes how you've been feeling over the last couple of weeks, how often you've had that symptom of being afraid as if something awful might happen. And then once again, I'm going to ask you to total the 7 numbers in this column to come up with your score for this anxiety test. If you scored 0 to 4, that shows very minimal anxiety. You can just use the self-help strategies we've talked about, or you may not even need that. If it's 5 to 9, that shows mild anxiety. And then you might want to consider, would it benefit me to talk to my doctor, maybe counseling would be helpful. And you would probably want to use these self-help strategies. If you're in that 10 to 14 range of moderate anxiety, then it becomes clearly indicated again that counseling can be helpful, that you should talk to your doctor, and you might even want to use the crisis resources as needed. And then in that final category of severe anxiety, it's clearly indicated that you should talk to your doctor, you should strongly consider counseling, we hope you will, and that you really shouldn't wait. You're obviously struggling quite a bit with some symptoms of anxiety that are more than likely interfering with your life, and it would really be helpful to get some help and support for that. So those are the first two assessments. We're going to go to the next slide, and Lisa Andrews is going to pick up from here and do the next assessment.
All right, hi everyone. So this is the third of our 3 assessments. It's about caregiver stress. So we're going to do a quiz for the caregivers who are attending. I realize that this won't apply to everybody, but anyone who has responsibility for a loved one is considered a caregiver. So as with the other quizzes, write down the number that best matches your answer. These questions are a little bit more than the last 2. There are 14 questions in total, so it'll be a long column on your paper. And for this quiz, we are going to use the following scale. So the question is, in caring for a loved one, how often do you have the following experiences? And so I'm going to read that list of experiences, and your answers will be on a scale of 1 to 7. 1 meaning never, I never experienced this when caregiving. 2 is once or twice. 3 is rarely. 4 is sometimes. 5 is often. 6, I usually experience this when caring for a loved one, and 7 is always. I always experience this when I'm caring for a loved one. So those will be at the top, and we'll go through the list of questions. So in caring for a loved one, how often do you have the following experiences? Next slide. Okay. The first one is feeling resentful. Never, once or twice, rarely, sometimes, often, usually, or always, that 1 to 7 scale. In caring for a loved one, how often are you feeling trapped? It's number 2. The third question is being tired, not getting enough sleep. Never, once or twice, rarely, sometimes, often, usually, or always. That's when caring for a loved one, how often are you feeling weary? How often are you experiencing feeling weary? The next question is, in caring for a loved one, how often do you have the experience of feeling troubled? The next question, feeling helpless. So again, in caring for a loved one, how often do you have the experience of feeling helpless? And number 7, in caring for a loved one, how often do you experience poor appetite or overeating? And again, that scale of 1 to 7, 1 being never, 7 being always. We'll go to the next set of questions. In caring for a loved one, how often do you experience feeling disillusioned? How often, number 9, do you experience feeling useless? And for number 10, in caring for a loved one, how often do you experience being utterly drained of feeling? So again, the answer choices: 1, never; 2, once or twice; 3, rarely; 4, sometimes; 5, often; 6, usually; or 7, always. The next question is, in caring for a loved one, how often do you experience feeling burned out? And then being unhappy. In caring for a loved one, how often do you experience being unhappy? The 13th question is feeling anxious. How often are you feeling this when caring for a loved one? And the final question on this quiz is feeling rejected when caring for a loved one. How often are you feeling that? So I'll give you a moment. I'll go over the scale again. Never, once or twice, rarely, sometimes, often, usually, or always. And I'm going to go ahead and move to the next slide, which is adding up the score. So I know those are bigger numbers than the last couple and a longer set of numbers. So I'm going to give you a minute or two to add up your score. And so while you're doing that, I'll kind of explain the score. So 60 or less is a number that you're looking for. So if you have scored 60 or less, you're in good shape. In terms of when you're adding up, if you get between 60 and over, that's maybe an indication that the stress of taking care of your loved one is beginning to take its toll. And when you're adding things up, if you get to 90 or higher, that's really an indication that you are living with high levels of caregiver stress and what we call caregiver burnout, which is maybe something you've likely heard of people talk about. It's kind of a buzzword these days, burnout, but that's really what this caregiver stress scale is looking for is, are you on the way to burnout? Are you perhaps already there? So hopefully that's given you enough time to add up those scores. I am not great at mental math, so I give you another minute and then we will go back to Sharon for some healthy ways to cope.
So as you are adding up your scores for these 3 assessments, some of you are caregivers and some of you aren't, but all of you should have at least 2 scores and maybe 3. If your scores are high, doesn't mean you should panic. That means you're in the right place. That means you perhaps know that something's going on, that it's been hard for you to cope recently. And we're going to focus with the rest of our time on healthy ways to cope and also how to get the support that you need. So anybody can begin to have symptoms of depression or anxiety or undue stress and burnout when the demands of a situation are in excess of what we can tolerate, of what we know how to cope with. And we want to emphasize that help is available if you get to that point, but also that it's not unexpected, that it's not a weakness in any way if you are struggling with symptoms. We can all get to the point, and we've all been living through a global pandemic for over 2 years now. We can all get to the point where the demands, the stressors, just exceed our ability to cope, right? There's nothing, so unusual about that. We can all get to that place, even though we may have a different threshold, each one of us. So what are some of the things that you can do to cope in a healthy way? And there's a little mnemonic you'll see down the left side of the slide, the word FAST, which can be a way that you can remember this when you want to call this up, to notice that you're feeling really stressed, you're having a difficult time coping. And the F stands for focus on what you can control. We all do this. Sometimes we focus on a lot of things we can't control. Right now, my daughter's finishing her finals, and she told me she was late with one of them, and I'm focusing on what she did or didn't do, and it's making me anxious, right? That's out of my control. She's an adult. I can't control that. The whole pandemic, in many ways, is out of our control. There's so many things that cause us stress, traffic, from little things to big things, a serious illness of a loved one. All of these things sometimes are out of our control, and we can't change them, right? We can't change, the traffic, the pandemic, what our loved ones are going to do. But what we can do is try to focus on what we can control, and that can make a huge difference. So for example, with the pandemic, I can do some things that are within my control to stay safe. We all know what those things are at this point, right? We can wear a mask if we choose to do that, or get vaccinated, etc. I can maybe try to flex my hours so I don't run into huge traffic. Or if I'm not able to do that, I can listen to some really soothing music on the radio. I can tell myself traffic is just traffic. I can still enjoy this time in the car And if I'm a few minutes late, the world's not going to end, right? So those are things I can control. And that's where I'm going to shift my focus. And you'll notice you immediately start to feel better when you stop trying to control things that you have no ability to control. The A in the mnemonic FAST stands for avoid unreliable information. And so that's something that can really cause stress or even panic or depression, is if we're getting a lot of information coming at us and we don't know what to believe. And again, the pandemic is a good example of that. There's so much information coming from so many places. So we want to think about limiting that to sources that we can really trust and rely upon. Who do I absolutely trust to give me, the lowdown, the accurate information? Is there a news source that is respected? Is it my doctor? Is it my loved ones? Avoid unreliable information that often just causes confusion and anxiety. The S stands for seek support. That's something we all need to do. Again, needing support from other people is not a sign of weakness. It's a basic human need. Every one of us needs support from time to time, and we need to be proactive, not wait for somebody to call us, which sometimes never happens. That's out of our control, right? We want to proactively seek the support that we need, whether that's calling a friend or our doctor, going to a program like this one today. And then the T is just take a breath. Take a deep breath in like you were smelling the most beautiful bouquet of flowers. And then just exhale, blowing it all out like you were blowing out the candles on a birthday cake. Just taking a deep, slow breath is another really helpful way that we can cope. Next slide, please. And there we are. Here are some more healthy ways to cope. We can take a break, right? We talked about relying, only listening to reliable sources of information, but we also need a break from that, right? There's so many horrible things in the news that are so stressful. And I'm kind of a news junkie. I like to stay, on top of what's going on in the news. But if we're doing it too often, if we're compulsively checking in many, many times a day on the news, that can really get to the point where it's not at all helpful. So consider taking like a news fast, maybe a day with no news, or just checking in once a day at a certain time. And that includes social media. Social media can cause stress and alarm and sometimes make us feel lonely, even though it's supposed to make us feel connected. So think about taking breaks from those kinds of activities. Taking care of our body is so important to mental health, whether that's exercise class, just doing some deep breathing, stretching, and then our diet is so important, right? Sometimes, especially when we're busy, we're not thinking about what we're eating, but we want to eat healthy, well-balanced meals, and just take the time to do that is a way to take care of our physical and our mental health. During this pandemic, especially, so many people, and especially older adults, are getting deconditioned. They're getting weak from not going out as much. So you've got to exercise regularly. We've got some great programs at CJE.net. It's within your physical abilities, right? Exercising can be doing chair exercises. It can be going for a walk, whatever's right for your fitness level. And you can consult with your doctor about that. You want to be sure to get enough sleep and follow good sleep hygiene, which could be a whole separate program. I'm not going to take too much time on that, except to say that good sleep hygiene includes getting out of bed if you can't sleep for 20 minutes and doing something else that's not very stimulating, because bed is for sleep. So if you can't sleep, get out, do something else for a while, sleep in a darkened, slightly cool room. It's getting hot in our bedrooms, isn't it, right now? So we want to be sure that we've got a restful and peaceful environment. Avoid excess alcohol, tobacco, and substance use. That's good advice all the time. It's especially good when we're under stress, when we might reach for things that maybe aren't so healthy. Are there other ways we can cope that are going to be more beneficial to us? And then routine preventive health, whether it's getting vaccinated or just seeing your doctor for your annual physical or a flu shot, right? Not to forget all of that routine preventative health measures are in that category of things we can control. It's good for our mental health and our physical health. Next slide. It's really important to take some time to just relax and unwind. What are the things you're doing, not because you need to do them and get them done, but that you enjoy? And if you aren't sure what those are, to really kind of explore some interests, get back to basics. Is it a little bit of gardening? Is it, watching a favorite movie? Is it whatever it is for you, to take some time every day to do something just for you. And then to connect with others, right? Not just to reach out for support, but just to have our social needs met, to really be honest and open with the people we trust and not just be superficial, to be sharing with others how we're really doing. They probably really want to know. Having a creative outlet is important. And when I say that, some people say, oh, I'm not a good artist, I'm not creative. You don't have to be good at it. It's for the fun. It's for the experience of doing something to express yourself. It could be, taking pictures. It could be writing in your journal. It could be exploring something completely new. Like if you're physically able to do pottery, you could take a pottery class. You can do those adult coloring books. Try writing a poem. Anything that for you, you don't even have to share it with anybody, kind of feeds you spiritually by being creative, can be really helpful. And then finally, having a sense of purpose is so important. I know so many people who do better emotionally when they are feeling that they're contributing something in some way. And there's some examples given here of things you can do. It might be volunteering to, call somebody as a friendly caller who's feeling lonely, writing a letter to the editor to vent your outrage about what's going on in the news. I knew somebody who had Parkinson's and was really quite impaired in his mobility, but he still went to the hospital and pushed people's wheelchairs to get them from the doctor's office to the X-ray room. And so it was a short walk, and with the support of the wheelchair, it was something that he was really able to do, and it made a huge difference for his mental health that he was able to contribute something despite having a physical disability. So all of these are some practical ways we can check in with ourselves and remember to tend to our needs so that we can stay healthy physically and mentally and emotionally. And Lisa now is going to share some strategies for caregivers.
Thanks, Sharon. Some of these strategies for caregiving will overlap a little bit with what we've talked about for depression and anxiety, but there are some unique things about being a caregiver that make kind of managing that stress really important. So one of the things I hear a lot from people who are caregivers, and we're talking about it broadly, anybody who has responsibility for the well-being of a loved one. One of the most common things I hear is struggling to take care of one's own health. So, if you are somebody who's taking your loved one to a lot of doctor's appointments, don't forget to schedule your own. I'm just thinking from my own experience, I'm a new mom, and I don't know how many medical appointments I've taken the baby to, and I just realized, oh, I'm overdue for my annual physical, and just scheduled that. So not losing sight of your own health, you have to take care of yourself in order to provide care for someone else. Another thing is caregiving can feel really isolating, especially if you're doing it at home for a spouse or a parent or another relative or friend. And so don't forget to maintain those social contacts. You may feel like you have less time. You likely do have less time. But maybe utilizing one of these things that's come out of the pandemic, the ability to do Zoom and video calls, just like very quickly to see someone, to connect with them, to let yourself know that you're not alone in whatever way that's possible. The weather is much nicer now, so going for a walk with someone, that's doing two at once: social contact and taking care of your own health, exercising. And then calling on friends and relatives for help. This can be really tough, and you can get creative about ways to do this. If you just really need a meal, people typically want to be supportive to those that they know are caregivers. So allow yourself to say yes and allow yourself to ask. You likely know who is Who would you call on in an emergency, and don't wait for that emergency to get some support. And then don't forget to reach out and get additional help from community services and organizations, CJE, other community organizations. If you're caring for a loved one who has a specific illness, finding the organization that's specifically for that diagnosis, whether it's the Alzheimer's Association, whether it's the Association for people with Parkinson's, whatever the illness is, that whatever the reason you're caring for someone, there's likely an organization that will have even more specialized support, support groups, web message boards. So don't forget to avail yourself of that kind of support. And then try to find time for yourself to unwind when stress piles up. I like to think of the idea of you can't pour from an empty cup. So what are the things that really fill you up? What are the things that allow you to unwind? And get really creative about finding small ways to do that so that it doesn't feel like another thing you have to schedule, right? Whether I take some time in the morning to like really make a nice cup of coffee for myself, and that helps me unwind. I drink it slowly. You know, it doesn't have to be a huge thing. It can be if you're able to do that, but think about the small things you can do to help yourself unwind. And then get organized. So you are likely juggling a lot, especially if you're working or you have other obligations and you're caregiving. So come up with some routines and habits, automate some things, get some support from somebody about how you can streamline things and stick with the routine so that you don't have a lot of not emotional, but mental stuff to juggle, right? When you're more organized, you don't have to take the time to think about some of those automatic tasks, and you can use your energy for other things. Deal constructively with negative feelings. Know that caregiving, it is natural to have some difficult feelings when you're caring for someone else. It can take a toll, even if you're very happy to do it. So using techniques like journaling, reflecting on what you're going through, talking it over with someone, meditating. I like to think about positive self-talk and giving yourself compassion when you're in a difficult time. Usually we don't feel better when someone's judging us for feeling badly, so deal with those feelings constructively, allow yourself to have those feelings, and that will likely help you move through them. And then get help as needed, including counseling. Sometimes doing these self-care tips, it's just not enough, and having a dedicated time once a week or however often you decide with the counselor or therapist, so that is time dedicated just to you to hone in on these stressors. And then I'm going to talk a little bit about what is counseling to begin with. Like, what are we talking about when we say you should maybe seek counseling or therapy? So counseling, also called psychotherapy or just therapy, can be provided by a range of different clinical professionals. So by a social worker, myself and Sharon are both licensed clinical social workers, a professional counselor, or a clinical psychologist. There are many different types of professionals who can offer this service. CJE Senior Life, we have a counseling services department, and all of us in the department are licensed clinical social workers. And like Sharon said at the start, we are primarily doing telehealth at this point, really to kind of lower the risk for clients and for ourselves, but we do offer office visits and home visits where necessary. And so reach out if you are interested in that and you feel like that would be something you need. And so counseling psychotherapy is considered a healthcare service. And so these services are covered by Medicare and other insurance. So you can also call your insurance to see what they cover, or when you're seeking counseling, they will likely do a check of your benefits to see if there will be any out-of-pocket cost, and Medicare really does cover counseling. And available via telehealth. This is a thing that CJE had not done before the pandemic. Some therapists have, but the ability to, especially if you're a caregiver and have trouble leaving home when you're caring for someone, we can connect with you via Zoom or through just the phone itself. So we provide services primarily in that way at this time. So if you've never been to therapy, it might be a little bit intimidating. What is therapy like? So seeing a counselor or therapist is actually a pretty unique relationship. It's different than talking to a friend or family. Friends and family will often give you advice or may have a judgment or an idea about what to do. Therapy provides a different space where you're able to really think through with somebody else what's going on and what has the capacity to help. So there won't be a judgment, and the counselor generally won't give advice. Sometimes we have resources that we know about or things that we suggest that might be helpful, but we're not advice givers. We're there to really listen and understand what's going on for you, because everyone is unique. And from that listening, we work together collaboratively to see what might relieve some of the stress that you're going through, the depression, the anxiety, the stress around caregiving. So really the role is to listen and to help you seek your own path to figure out what is right for you. So therapists have many different styles and approaches. So one of the things to think about is if that therapist is the right fit for you. And generally in a first session, the therapist will talk about how they practice, and you want to see if it's a good fit. Generally, the idea is that the most important thing in therapy is having that relationship with the therapist. And so you want somebody you feel comfortable with. The therapist may want to understand some of the patterns of coping that you've used in the past. So when people come to me, I say, well, what have you done when something like this came up before? Kind of building on your own strengths, your capacity. We may ask how you understand how losses or challenges that have happened in the past might be reawakened by losses or challenges that you're experiencing now. Things about what happened to you early on. If you had an early loss in your life, does that affect how you may be grieving now? If you had a parent or caregiver who struggled with anxiety, how does that maybe shape how you understand anxiety that you're experiencing now? And therapists sometimes can give you homework to practice a new way of thinking or coping or to learn new skills. So people really like to go away with some ideas for what to do next and some things to think about before their next session. So that some therapists really utilize that kind of direct support to give you a worksheet or ideas and things to think about and practicing skills. And we also wanted to make sure to provide some resources. You've taken some quizzes today. You may be thinking about the stressors you're dealing with differently. And so we wanted to make sure to take some time to provide you with these resources. These will also come in an email. You will get the slides, so you'll have these resources when you get an email follow-up. So one of the ones that we really encourage people to use is the friendship line. So it's a warm line for older adults who need support, and it's available 24/6, I think not on Sundays. And the phone number is listed here. So they'll provide some support for you if you call. A warm line means that sometimes it's on a hotline where they will immediately have someone available. Sometimes they will give you a time that they'll call back. JCFS, Jewish Child and Family Services, one of our sister agencies, has a warm line. The number is listed here, and they are open Monday through Thursday, 9 a.m. to 5 p.m. and Fridays, 9 to 4 p.m. That's Central Time. And the state of Illinois has a warm line as well. So the number is listed there. You listen to the prompts, and it operates from Monday through Friday, 8 to 5 p.m. And then if you answered in the quiz that Sharon gave about depression, about feeling like you're thinking you might harm yourself or that you'd be better off dead, we encourage people to utilize the National Suicide Prevention Lifeline. So that is 1-800-273-TALK. And if you or someone you know is in crisis, whether they're considering suicide or not, please call the toll-free lifeline to speak with a trained crisis counselor 24/7. The calls to the National Suicide Prevention Lifeline are confidential and free. All of these resources are free. And there's also locally the NAMI Chicago helpline. So they have mental health counselors available at this number Monday through Friday, 9 a.m. to 8 p.m. and Saturday and Sunday, 9 to 5. And so the next piece is going to be some relaxation exercises. As we've talked about all of this. Oh, Sharon, did you want to say something?
No.
Okay, just wanted to provide you guys with a little bit of relaxation, a quick fix in stressful moments. So these are kind of stress busters that you can reach for at any time. Whether you have 1 minute or 3, these exercises can really help you kind of get the support you need in the moment, kind of reset. And so if you'll allow me, I will lead us in an exercise for when you've just got 1 minute, when things are really reaching the point you're feeling really anxious or perhaps really down, or the stress of caregiving is really getting to you. One of the things you can do is just place your hand just beneath your navel on your belly so that you can feel the gentle rise and fall of your belly as you breathe. So breathe in. I'm going to pause for a count of 3 and then slowly breathe out. And then pause for a count of 3. And so you can continue to do this for 1 minute, pausing for a count of 3 after each inhale and exhale. And I always tell people, if you get lightheaded, don't do it, change the pace. But the idea is that you're really slowing down and kind of feeling yourself. Breathe in and breathe out. When people are panicking or stressed, I always say, if you're breathing, you're alive. And if you're alive, that's a great word. That's good. We want to know that you're hanging in there. This is not, you will get through this. You're still breathing. And so that touching in and feeling yourself do that is a great way to just kind of release some of that immediate stress. And an alternate thing to do is when you're sitting comfortably, take a few slow, deep breaths and quietly repeat to yourself, I am, as you breathe in, and at peace as you breathe out. So you can repeat slowly 2 or 3 times. I am at peace. Sometimes the counting aspect of things can get a little difficult. So I like to use this idea of saying a mantra, I am at peace, or this is okay as things go. And we have a little bit more time, and please utilize the Q&A to ask us some questions because we're coming right here to the end. So when you have a little more time, I won't go through this with you, but you'll get these instructions. So when you have about 2 minutes or so, count down slowly from 10 to 0, counting backwards. With each number, take in a complete breath, inhaling and exhaling. So for example, breathe in deeply, say 10, 9. And again, with any of these breathing exercises, if you feel lightheaded, count down more slowly, space your breaths further apart. We don't want you to get lightheaded. That's not what we're doing. We're trying to have you really feel your breath, feel grounded. And when you reach 0, you should likely feel more relaxed. And if not, go through the exercise again. Sometimes it takes a little bit of repetition. And if you don't feel relief the first time, keep trying. You know, these exercises are there so that you can count on them in a quick fix and then take your time and put in some of those other self-care strategies as you go along. So now we're here to the Q&A. I'm just gonna stop our sharing here.
And please use that Q&A feature to ask us any questions you may have, any comments you may have about today's program. There were a couple of questions that came up that I think we responded to already. Somebody had asked if these resources were free, and yes, indeed, they're all free. I was just going to make a point about the National Suicide Hotline. We gave you that number on the resource slide, and that's indeed the right number. But come July of this year, we're going to have a National Suicide 3-digit call line, which is a wonderful development, just to make it easy. So everybody knows that number, just like we all know 911. And the 3-digit National Suicide Hotline that won't start until July of this year is 988. So from later this summer, if people need help, instead of dialing 1-800-SUICIDE, they will just dial 988 and be able to get assistance right away. So that's a really positive development, that mental health needs can be urgent too, and it should be easy to get the help that we need. Just checking to see if there's any questions. I'm not seeing anything pop up. Let's see where we're at on time, and I'm just going to make some closing remarks if there aren't questions, but it's not too late.
Oh, Sharon, we do have a question. So someone's asking, what role can spirituality play in helping older adults and caregivers to cope? That's a great question.
It's a great question. I can weigh in if you'd like to add anything, Lisa. Sure. I think spirituality can be so important, and I think that means different things for different people. For some people, that may be going to religious services at their synagogue or church or mosque. That may be communing with nature. That may be talking to a spiritual or religious advisor. That may be saying prayers at home. That may be whatever spirituality means for you, but it's critically important that something that sort of transcends the day-to-day. And so for me, even things like creativity can be a form of spirituality. Connecting with other people can be a form of spirituality. And for some people, it may be something else entirely. But I think that's a great question and a very important element to keep in mind. And certainly at CJE, that's something that we value. If you want to add anything, Lisa.
Yeah, I was thinking along the lines of like, right, it looks differently for everybody. And faith communities can often be a great place to find support, camaraderie, resources. And along the lines of what Sharon said is, for a lot of people, that's nature and communing with nature. For me, that's often nature and poetry. There's something about reading poetry that like kind of speaks to the greater world and our purpose. And I think that's also can be a place in finding meaning when you're a caregiver or when you're kind of struggling with anxiety, depression. That aspect of spirituality is having a meaning bigger than oneself.
I do think in terms of religious services, it's been really challenging for many people during the pandemic. And some people have gone back to face-to-face services, and some people just haven't, felt comfortable or safe doing that yet. But I think to find ways to meet those needs, even within the constraints of perhaps not going back in person yet, whether that's attending, some of the synagogues or other religious institutions have like a Facebook Live service. Some of them have a Zoom link where you can join. Some people are going in person. Some services are even being held out online, or you can find YouTube services. So we're happy to help at CJE if you're having trouble connecting to your spiritual community. Always feel free to reach out to us if you need ideas and suggestions for ways to do that. And our senior line number is 508-1000. And we're happy to help with resources and ideas. Let's see, I see something else popping up here. Somebody said, thank you for your presentation. Very good tip about the role of unreliable sources of information, adding to emotional difficulties. We're not even being aware of it, which is so true. It just kind of creeps in, doesn't it? And they thanked us as well for information about the 988 hotline and noted that that's good news.
The other thing, Sharon, I'm thinking about is if you live in the city of Chicago and you're calling 911 for a mental health emergency, perhaps before the 988 comes into effect, or you just need someone for well-being check, you can request to have a crisis trained officer. So there are police officers in the city of Chicago and in some surrounding communities who are trained to support in a mental health emergency. And so if you have the ability to kind of the wherewithal to think about that, you should say that and request that an officer who is CIT trained, crisis intervention training, so that they're able to kind of sensitively deal with some of the things that you might need support in during an emergency.
That's a great point. Also, if you were calling on behalf of a loved one and wanted to be sure that the officer or officers who arrive have that advanced training, then that's certainly something you could request for anybody. And yeah, sometimes there can be a mental health emergency, right? Just the same way we can have a physical health emergency. And we should avail ourselves of help with everything. An ounce of prevention is sometimes worth, what's the expression, a pound of cure?
Yeah.
Is that right? I always get my expressions confused. But so today we're talking primarily about prevention and about treatment, but if it escalates to the level that it's an emergency, that's what those emergency resource providers are there for, in the same way that there's an emergency room if you were having a physical health emergency. I just also wanted to say a few remarks to thanks folks for attending today. As you leave our webinar today, there's an evaluation that's going to pop up or should pop up if the webinar software is working right, which we believe it is. And just take a moment, if you would, to answer those brief questions about today's program. It really helps us to have your feedback so we know what to do for future programming, what's effective, what you'd like to hear more about. And then we're going to send you copies of today's slides in an email. You'll also get a link in an email to this recording that'll be on our website, cje.net, on the Insights on Aging page. And you'll see all the previous Insights on Aging recordings there as well. This one will take a while to actually show up there. It could even take a few weeks. But once that's up on the website, you'll be able to see this one too at that same link. So we want to thank you so much for joining us today. We hope that this was useful to you, and we appreciate your spending an hour with us to check in on your mental health.
Yeah, I think it's so important that we talk about this topic more and more. It gets coming up a lot in kind of the phase that we are throughout the pandemic, and that we really shouldn't be afraid to talk about these issues and to address them. It's a component of health, just like physical health.
Thank you so much. Be well, everybody. Enjoy your weekend.